Look at your hands right now. Turn them palm up and look at the color of your skin and the creases. Now think about the last time you felt truly rested after a full night of sleep. If either of those things gave you pause, I need you to stay with me for the next few minutes, because what I am about to walk you through could be the most important health information you receive this year. Here is what almost no one explains to you in a 1-2 minute office visit. Pancreatic cancer kills more older Americans every year than colon cancer. And yet, in my 15 years of practice, I cannot count the number of times a patient sat across from me and said, "Nobody ever told me what to look for." That is not because the information does not exist. It is because the average office visit does not leave time to go through 8 warning signs in detail, explain what each one means biologically, and make sure you genuinely understand the difference between a sign that needs attention today and one that can wait. Today, I am giving you that time. The reason this disease is so dangerous, especially for people in their 60s, 70s, and 80s, comes down to anatomy. The pancreas sits deep inside your abdomen, tucked behind your stomach, surrounded by blood vessels and nerves. A doctor cannot press on your belly and feel it during a routine checkup. Standard annual blood panels do not screen for this. And the symptoms it produces in its early stages are so ordinary sounding that most people, and I say this with compassion, not criticism, explain them away for months before anyone looks further. By the time the disease shows up clearly on a scan, it has often already progressed to a point where treatment options narrow dramatically. The overall survival rate for pancreatic cancer sits around 11%. I want you to understand something important about that number. It is not 11% because there is no treatment that works. It is 11% because the vast majority of cases are caught late. When this disease is found in its earliest stage, before it has spread beyond the pancreas itself, survival outcomes are dramatically better. The difference between a stage 1 diagnosis and a stage 4 diagnosis is almost entirely a question of timing. And timing, in this case, is determined by what you notice, when you notice it, and whether you take it seriously. So let us go through all 8 signs together one by one, starting with the one most people write off as a simple hydration problem. The first sign is dark urine that keeps coming back. Think of your liver as a processing plant that produces a yellow-orange waste product called bilirubin. That is the scientific name. But think of it simply as a pigment your body needs to dispose of regularly. Under normal circumstances, that pigment travels from the liver through a thin tube called the bile duct, flows into the intestines, and eventually leaves the body in your stool. That is why healthy urine is pale yellow and healthy stool is brown. That system works perfectly when everything is open and flowing freely. Now imagine a tumor beginning to grow in the part of the pancreas that sits right next to that bile duct. As the tumor grows, it presses against the duct from the outside, the way your thumb would squeeze a garden hose. The flow slows, the bilirubin backs up, and when it has nowhere else to go, it spills into the bloodstream. Your kidneys then try to filter it out, and the result is urine that turns dark yellow, sometimes brownish, sometimes the color of strong tea or cola. Here is the detail that separates this from simple dehydration. If you drink more water, it clears up temporarily. But the next day, it darkens again, and the day after that. Because the tumor is still there. Water cannot dissolve a tumor. The pattern is what matters. Dark urine that cycles between dark and light over more than 2 weeks, regardless of how much you drink. That pattern is not a hydration issue. That is your body telling you something is mechanically wrong inside, and it deserves a phone call to your doctor. This week, not next month, this week. Let me tell you about someone I will call Margaret, 7'1", from Phoenix, Arizona. She came in after about 6 weeks of noticing that her urine looked darker in the mornings. She had been drinking extra water, it would improve for a day, then return. Her previous doctor had told her it was probably just her morning concentration being normal. When she described the cycling pattern to me, darker, lighter, darker again, over and over, we ordered abdominal imaging that same afternoon. That scan found a small tumor in the head of the pancreas that had not yet spread. Margaret had surgery within 3 weeks. 2 years later, she was gardening in her backyard. The pattern was the key. She paid attention to the pattern. The second sign is pain in the upper abdomen that travels to the middle of the back. Most older adults who experience this kind of pain are told it is arthritis, a muscle strain, an old injury flaring up, or acid reflux. Sometimes all 4 in the same visit. And while those conditions are all real and common, There is a very specific pattern of pain that belongs to a pancreatic tumor, and knowing the difference can change everything about your next doctor's appointment. The pancreas is surrounded by one of the densest nerve networks in the entire abdomen. When a tumor grows and presses into those nerves, it sends pain signals radiating outward in multiple directions at once. The pain typically begins as a dull, persistent ache in the upper abdomen, not the lower belly, not the sides, but the upper center, just below the breastbone, sometimes slightly to the left. Then it wraps around toward the mid-back, and patients often describe it as a tightening band across the torso. Three specific characteristics separate this from ordinary back pain. First, it worsens noticeably about 30 to 60 minutes after eating, not immediately, but in that window after a meal when digestion is active. Second, it gets significantly worse when you lie flat on your back. Many people with this symptom find themselves sleeping in a recliner or propped on multiple pillows without fully understanding why lying flat makes the pain unbearable. Third, it does not respond the way normal pain does. Ibuprofen, heating pads, rest, they may dull it slightly, but the pain returns in exactly the same pattern every single time because you are addressing the symptom, not the source. If that pattern is familiar to you right now, please do not keep assuming it is your back. When you speak to your doctor, be specific. Tell them the pain is in my upper abdomen and it radiates toward my mid-back. It gets worse about an hour after I eat, and lying flat on my back makes it significantly worse. Those four details together tell a completely different story than my back has been bothering me. They guide a doctor toward the right investigation. The third sign is feeling full after just 2 or 3 bites of food. This is one of the most consistently overlooked symptoms I encounter. Patients tell me their appetite just is not what it used to be, and they accept it as a natural part of aging. Sometimes it is, but sometimes it is a tumor physically compressing the stomach from behind. Here is the biology. The stomach sits directly in front of the pancreas. When a tumor grows large enough, it presses against the back wall of the stomach and reduces its capacity. Your stomach cannot hold its normal volume of food. You take a few bites, and your stomach signals that it is full, not because you have eaten enough, but because there is simply no room. At the same time, the tumor interferes with the pancreas's ability to produce the digestive enzymes that break food down efficiently. Food sits in your stomach longer than it should. The signal of fullness persists. Here is why this matters beyond the discomfort. When you consistently eat only 2 or 3 bites per meal, you lose weight without intending to. And because the digestive enzymes are compromised, even the small amount you do eat is not fully absorbed. Research published by leading cancer centers has consistently identified unintentional weight loss, meaning more than 5% of your body weight over 2 to 3 months, as one of the most serious warning flags in all of medicine. If you have lost 10 or 15 pounds without changing your diet or increasing your activity, that is not good fortune. That is a red flag that requires investigation. Drop your age in the comments below. I want to hear from you, and I read every single one. If any of these first 3 signs sound familiar, keep watching because the next 5 complete the picture. The fourth sign is yellowing of the skin or eyes, often accompanied by intense itching. Think of bilirubin, that waste pigment we discussed, with the dark urine, building up not just in the bloodstream, but now depositing itself into your actual tissues. When enough of it accumulates, your skin takes on a yellowish tone. The whites of your eyes turn yellow. In people with darker skin tones, it shows most clearly in the eyes and in the palms of the hands. But here's the part almost no one warns you about. An intense body-wide itching with no rash, no explanation, and no relief from lotions or antihistamines. That itching happens because bilirubin deposited in the skin directly irritates the nerve endings underneath. It does not stop on its own. It does not respond to topical treatments. It only resolves when the underlying cause is addressed. The dangerous reality about jaundice, the yellowing in older adults, is that it looks identical to jaundice caused by gallstones, which are extremely common in people over 60. Same yellow color, same dark urine, same itching. And because gallstones are so frequently the first thing a doctor considers, a more thorough investigation can be delayed by weeks, sometimes months, while gallstones are ruled out one test at a time. This is exactly why you cannot walk into your doctor's office with one symptom in isolation. You need to bring the full picture. Dark cycling urine, upper abdominal pain that radiates to the back and worsens after eating and when lying flat, early satiety after just a few bites, and now yellowing of skin or eyes. That combination tells a story that demands imaging, not a simple blood test and a follow-up in a month. The fifth sign is a blood clot that appeared without an obvious explanation. I want you to think carefully. Have you, or has someone you love, had a blood clot recently in the leg, in the lung, without a clear reason? No recent surgery, no long airplane flight, no prolonged bed rest. Here is what most emergency room physicians do not routinely explain to their older patients in the moment. Certain cancers, including pancreatic cancer, release proteins into the bloodstream that alter how blood behaves. They make it clot too easily, in places and circumstances where it should not. The most common location for this abnormal clotting is the deep veins of the legs. Your calf or thigh swells, feels warm, and aches with a heavy, dull pain that does not improve with rest or elevation. The life-threatening risk is what can happen next. A piece of that clot can break free and travel through the bloodstream directly to the lungs. Sudden shortness of breath, sharp chest pain that worsens when you inhale, a rapid, unexplained increase in heart rate. If those three things happen together, call 911 immediately. Not your doctor's office, not urgent care, 911. Research has shown that in a significant number of pancreatic cancer patients, an unexplained blood clot was the very first sign that something was wrong, appearing sometimes up to 6 months before the cancer was detected. 6 months of potential lead time. If you have had an unexplained clot, ask your doctor directly whether an abdominal imaging study has been considered, not as a panic response, as a responsible, informed question. Let me tell you about someone I will call Robert, 7'8", from Nashville, Tennessee. He came to me after being treated at the hospital for a blood clot in his left calf. No surgery, no travel, no obvious cause. His attending physician treated the clot and discharged him with blood thinners. Robert's daughter had seen some health information online and asked me whether there could be another reason for the clot. We ordered an abdominal CT scan. The scan revealed a pancreatic tumor that had not yet spread to the lymph nodes. Robert went on to receive treatment within that same month. He told me later that his daughter's question was the question that changed everything. The sixth sign is recurring low-grade fever with night sweats. Your immune system is a sophisticated defense network, and it responds to threats by generating inflammation and heat. When that fever resolves in a day or two and does not return, you likely fought off a normal infection. But when low-grade fever, around 99 to 100 degrees Fahrenheit, appears, fades, then returns again 3 or 4 days later, over and over without ever fully resolving, that cycle tells a different story. Pancreatic cancer creates persistent internal inflammation. The tumor itself, the obstruction of the bile duct, the buildup of bile in areas where it should not be, all of this triggers a continuous immune response. Your immune system is not fighting something it can overcome, it is fighting something that does not go away. The result is that recurring cycle of feeling slightly off, then feverish, then briefly better, then feverish again. Many older adults describe sudden, deep chills, the kind that go right through you, even in a warm room, followed within hours by that low-grade fever. Not high enough to feel dramatically ill, but persistent enough that you never quite feel well. When that fever pattern is combined with night sweats, waking up damp from perspiration without having felt overheated when you went to sleep, the combination warrants something more than a prescription. It warrants imaging. A fever that returns repeatedly over several weeks with no infection identified is not a recurring bug. It is a signal that your body is responding to something internal that has not been found yet. The seventh sign is a fatigue that sleep does not fix. Normal tiredness has a cause you can point to, and rest solves it. This is different, and the biology explains why. Cancerous cells in the pancreas compete aggressively with your healthy cells for glucose and nutrients. While your body is trying to fuel your organs, your muscles, and your brain, the tumor is intercepting that fuel for its own growth and replication. Your body is running on less than it needs, hour after hour, day after day, regardless of how long you sleep. The quality of this fatigue is distinct. You sleep 8 or 9 hours and wake feeling as if you never rested. You sit down in the afternoon and rise feeling just as heavy as when you sat. Tasks that used to require no particular effort, walking to the mailbox, carrying grocery bags from the car, climbing a flight of stairs, begin to feel disproportionately exhausting, not mildly inconvenient. Genuinely, surprisingly difficult? The difference matters because most older adults, and I say this with the deepest respect, have been conditioned to accept this kind of fatigue as aging. It is not always aging. When it is new, when it is progressive, when rest genuinely does not restore you, when it is accompanied by any of the other symptoms in this conversation, that fatigue deserves investigation, not acceptance. Now, before I give you the eighth and final sign, I want to pause for just a moment. Because if what we have covered today has been useful, these 7 signs, the biology behind each one, the specific patterns that distinguish normal aging from something that requires attention, I want you to know that I have put together a much more comprehensive resource for my patients. It covers not just cancer warning signs, but the medications most commonly overprescribed in older adults and the questions you should be asking your doctor about them, the specific foods that function as medicine for blood pressure and blood sugar after 70, and a full guide to how your body changes after 70 and what those changes actually mean. It is called the Complete Senior Health Vault, and you can find it through the link in the description below or by scanning the QR code that is on your screen right now. I'm mentioning it here because what comes next, the 8th sign, is the one I have seen in nearly every advanced case I have ever treated. And the context from those other guides will help you understand what to do with this information once you have it. The 8th sign involves what you see in the bathroom, and it is the one nobody talks about. The pancreas has a critical job. It produces digestive enzymes that break down fat from the food you eat. When a tumor obstructs the pancreatic duct, think of that duct as the delivery pipe that sends those enzymes into the small intestine. Those enzymes cannot reach their destination. The fat you consume passes through your digestive system, undigested. And undigested fat changes your stool in very specific, easily recognizable ways. Your stool becomes pale, almost gray or clay-colored instead of the normal brown. It develops a greasy, oily sheen that is visible. Because of its fat content, it floats in the toilet bowl rather than sinking. And it produces a smell that is significantly more foul than anything you would consider normal. This is not a reaction to something you ate. This is a direct mechanical signal from your pancreas indicating that something is blocking its function. Alongside this, you may notice nausea, particularly after eating fatty or heavy foods, sometimes vomiting, and a persistent feeling of fullness and discomfort in your abdomen after meals. And because your body is not absorbing the fat you eat, it is also not absorbing the fat-soluble vitamins, vitamins A, D, E, and K that your organs depend on. This accelerates weight loss. It accelerates fatigue. It accelerates the progression of everything else on this list. Pale, greasy, floating, foul-smelling stools that persist for more than 2 weeks require a phone call to your doctor within 24 hours. Not in a week, not at your next scheduled appointment. Tomorrow. Now, I want to speak to you directly for a moment because what you do in the next 24 hours is genuinely important. If you recognize 2 or more of those 8 signs while watching this video, your next step is the most consequential health decision you will make this year. Write down every symptom you recognized. Be specific. The exact symptom, when it started, how often it occurs, whether it is getting worse over time. Then call your doctor and read that list aloud. Do not summarize. Do not say you have been feeling off. Read the specific symptoms in specific language. Specific symptoms prompt specific investigations. Vague complaints get vague responses. If your doctor dismisses your concerns without ordering any imaging, you have every right to advocate for yourself. Ask specifically whether a CT scan or abdominal ultrasound is appropriate given your symptoms. You are not being difficult. You are being the only person in that room whose life is directly at stake. Pancreatic cancer found in its earliest stage is a fundamentally different situation from pancreatic cancer found after it has spread. The survival outcomes are not slightly different, they are dramatically, almost incomparably different. The single variable that determines which outcome a person faces is whether they acted on what their body was telling them and when. The people who waited, the people who called it aging, the people who said they would mention it next time, many of them did not get a next time. You still have this window. Please do not close it by doing nothing. And never stop a medication on your own. If any of what we discussed today changes how you are thinking about something you are currently taking, bring that conversation to your doctor. This information is meant to educate and to empower you to ask better questions, not to replace the guidance of a physician who knows your full health history. In the next video, I'm going to show you something that almost no one outside of a specialist's office ever hears about: the specific combination of just 3 of these 8 signs that, when they appear together, shifts the clinical picture significantly. And the single imaging study your doctor can order tomorrow that is designed to catch this disease before it reaches a second stage. Most older adults have never heard of it. Most general practitioners do not bring it up unless a patient asks. That is what we are covering next, and it is already on your screen. I will see you there.